So I'm going to talk about plaque control and rinsing. You are now aware of the significance of bacteria and the importance of plaque control in the success of your periodontal therapy. So we want you to rinse your mouth with the chlorhexidine mouthwash 2 to 3 times per day, and start brushing with the extra soft toothbrush. And we want you to do that in about 5 days after surgery. Do not brush any areas that have any dressing in place or any sutures or anything like that. After 14 days, you may go back to your normal soft brush, flossing, and the use of gentle irrigation if we have recommended it to you. If you have a gingival graft, don't brush this area until after your first post-operative check, which will usually be about 3 weeks, because we don't want you knocking any of those stitches out. When food retention occurs between the teeth, use a gentle toothpicking or vigorous swishing with the mouth rinse to remove this.